Despite the best efforts of governments at all levels, the confirmed cases of coronavirus in Nigeria continues to climb steadily, necessitating an even more vigorous approach in public sensitization efforts, local production of personal protective equipment, more stringent lockdown enforcement procedures, and better protection for frontliners in the fight against the global pandemic. The unusual times have also birthed new synergies across regions and party affiliations in the collective quest to defeat a raging contagion that does not consider party logos, regional or ethnic leanings. The general motto right now is how to stay alive and keep the nation on an even keel. On Political Update today, we look at the patriots of this struggle, medical professionals, scientists, and the average citizen lending a helping hand to a neighbor in distress. We'll also follow the COVID-19 numbers in the north and in the south. Is the situation going south? I am Fisai Ogunfuyi. Welcome. We begin by giving you a report from the Presidential Task Force on COVID-19. Mitari Ikpen is a regular on this beat.
Chairman of the Presidential Task Force on COVID-19, Boss Mustafa, acknowledged that there was breach of regulations at the funeral of late Chief of Staff to the President, Abba Kyari, but said the breach was unintentional.
The PTF recognizes regrettably the unintentional violation of the principles and protocols that form the core of our messaging to Nigerians at the funeral of the late Chief of Staff. Lessons have been learned and appropriate measures have been taken to close all gaps. We assure all Nigerians of their safety and the determination of the PTF to combat the pandemic.
After review of experiences gathered so far, the Minister of Health said fresh strategies are being developed towards containing coronavirus in Nigeria.
The worrying increase in the frequency and numbers of new persons with COVID-19 being recorded daily is attributable to this new strategy in combination with higher community transmission. A new national action plan is under development to adjust and address this development.
We continue to be concerned about the movement of large number of persons across state borders. We would like to appeal to state authorities to ensure that this does not happen, as this will further increase the risk of spread.
The Presidential Task Force noted that the national response against COVID-19 is Nigeria's most coordinated response to any health crisis in the nation's history, and says it will remain resolute and focused until coronavirus is defeated. In Abuja, Mitari Ikpen, NTA News.
There is an increase in the confirmed cases of COVID-19 in some states of the Federation and the Federal Capital Territory. Now, let's hear from Akimat Aliyu.
The Federal Capital Territory, from less than 5 confirmed cases of COVID-19 as of 22nd of March 2020, is presently now above 80. The Acting Secretary, FCT Health and Human Services Secretariat, Dr. Mohammed Kawu, pointed out that more cases are being recorded in Abuja, with increased testing capacity and community active case set carried out in Pape, Gishiri, Mabushi and Utako communities.
Mabushi is where we have problem. We tested about 175. Unfortunately, we got about 5 positive cases, and most of them have been moved to the treatment center in Asokoro. We also went to Gishiri community. We tested about 121. We also had 1 positive.
Dr. Kawu also noted with concern community infection transmission, which has set in, and if not properly handled, can lead to escalation of coronavirus cases. Meanwhile, in a search for practical analysis on issues surrounding COVID-19, I interestingly came across Esther.
What we've done is we've tried to use information from NCDC, the Nigeria Center for Disease Control, and the information we have on the isolation centers, and plug it into our GIS software to create an operations dashboard. So it shows you the spread of the virus. It's as easy as creating an application linked to the software where people can easily feel on their mobile phones suspect cases, track symptoms they are having, and the NCDC can visualize that on a dashboard and be able to locate people they know that require urgent treatment or urgent intake into their flow.
She noted that they are looking forward to partnering with the Nigerian Center for Disease Control and other government agencies, emphasizing tracking the geographic statistics as important to accurately combat the spread of the dreaded virus with necessary resources. In Abuja, Hakimat Aliu, NTA News.
Now, the increase in the cases of COVID-19 in the FCT may not be unconnected with the attitude of residents, especially motorists, to the lockdown directive in place. Austin Ayebe has been finding out.
With the increasing cases of COVID-19 in Nigeria and a low level of compliance by residents at the Federal Capital Territory, people are becoming apprehensive. They have raised almost free flow of traffic on the major roads within the city center and satellite towns like on the Musa Yaradua Expressway, popularly called Airport Road. Even though there are security checkpoints on the roads, no proper checks on who and why they are out, paving way for easy movement.
The enforcement, I don't think is effective enough, but I'm personally concerned.
It's quite worrisome. I'm sure not everybody are on essential duty, but well, I hope everybody will just listen to the advice from NCDC and the federal government so that
I want to go and wind up my glass inside the town.
Asked why the free flow, none of the security personnel volunteer comment, but the special assistant on communications and logistics to the Minister of State, FCT, says they are reviewing strategies on enforcement.
Still not in terms with the reality of this, the presence of the pandemic, the COVID-19 pandemic in the FCT, and it's really worrisome, but the administration will still continue doing its bit to ensure that people comply.
The medical expert who decried the attitude of some residents says with the new phase of the pandemic in Nigeria, lockdown is the only way to prevent community infection.
What is happening now in Nigeria, we're in the phase of community transmission. Lockdown has to be with the cooperation of the population. They have to understand that, look, the only way we cannot go to the top of that curve, we can flatten the curve down earlier, is for us to have a total lockdown.
He appealed to residents to comply with the lockdown directive by the government for public goods. In Abuja, Austin Anyebe, NTA News.
All right, Austin's reports set the tone for today's discussion, and joining us is Ijoma Iberibe. Reverend Ijoma Iberibe is the President Woman African Initiative that helps women in terms of skill development and others. Thank you for joining us today.
Thank you very much.
You saw some of those reports. You've been living here since you came back from the US. How would you describe compliance to lockdown so far?
Well, I would say that it's not really taking the shape it's supposed to take. For instance, if you say that we are protecting our citizens from such a pandemic, all we need to do is to take a strict measure. What I mean by strict measure is not like maybe bullying people, you understand? Making people, educating people, making them understand that if we do not comply with the NCDC directive, that there's going to be a lot of problem for us, because this thing is not just like maybe something that you can easily tell when it's coming to you. You can't, because it's a virus that can stay on somebody for 72 hours, like they said, and all those things. So it's something that we need to come together, and the government and the people need to understand themselves and then keep strictly to what they want us to do. I think by that, because looking at it, Nigeria will have a lot of borders here and there. So if we lock down the airport, airways, what about the land borders?
We have done that, but let's interrogate this a little.
Yeah.
Some of the respondents there, one of them said he wanted to get back to town to lock his window and was carrying about 4 other people along.
Yeah.
It seems to me as if there's willful disobedience in some cases as well.
Yes, there will be, because one, like me, if not that, I was like, I keep watching what the news all over the world, like South Africa, Ghana, US, Germany, and all those places. And then I come back to Nigeria to come and really look at what the news is. For instance, if I say that this pandemic has come to Nigeria, good and fine. There's something we need to do for people to know that of a truth. If you're not afraid of something, you understand, you behave anyhowly. And when
let me before I'll let you land on that.
Okay.
Because I don't want to lose this trend. You told me about it before we came on set about what Women Africa is doing in terms of rural women. That is, if we are doing this in the cities, the fear is that at the rural level where to educate is even a bit more cumbersome. What are the challenges there and what is the feedback like so far?
For the rural women, from what we have done so far, many of them don't believe that there's anything like that. They feel that it's something that is meant for the white people, or something that is meant for the rich, or for the Abuja, people that are living in Abuja. That's what they are thinking. You understand? So when you try to tell them and educate them on social distancing, and you tell them wash your hands, some of them don't even have the water to wash their hands. So what do? So we need to actually look at what the rural areas, what they are lacking, and do it for them. Because if you say that you want to stay in Abuja and keep saying social distancing, wash your hands, personal hygiene, and all those stuff, the village people don't understand that. They still go to fetch their firewood, they still go to make their food somehow, and still some of them don't even have a good toilet system. You understand? So that is also a problem.
Let's take this very quickly. Kano is perhaps one of Nigeria's biggest metropolis, and the numbers coming out of Kano is a source of worry. Let's hear from Mohammed Rabiu.
The rate at which people are dying in Kano metropolis is quite alarming, though there is no official record on the number of fatalities. But in Kogi quarters alone, more than 70 people have died in 2 days. Most of the casualties are reported to be elderly.
They brought a number of remains of people amounting to 70 in this cemetery. We buried 20 people this morning. In fact, the undertakers pleaded with us that work is too much for them, as more are coming.
The situation at the Tarauni Cemetery, another suburb in Kano metropolis, the story is the same, as 40 people were reportedly buried. While at that of Dandolo recorded 35, all these incidences occurred within 2 or 3 days. This ugly trend is raising concern among the medical experts on the causes of such tragedy.
Any patient that is suspected to have COVID-19 infection, the proper steps will be taken. So even there is increased number of deaths, it's unlikely that this number of deaths are due to COVID-19, because such people are treated separately, such people are given separate special attention, so that they will not be allowed to contaminate or to infect other people. So if indeed there is an increase in the number of deaths in the last 48 hours, it's something that needs to be verified, it's something that needs to be investigated.
Though the State Ministry of Health, in a press release issued by the Public Relations Officer, says is working towards verifying possible causes of the death while praying for the repose of the departed souls. Muhammad Rabiu Ali, NTA News.
All right, before we go to our next report, we'll go to our next report. We've spoken about some of the dangers, the issue of sensitization, which you have rightly mentioned in terms of what One Africa has done in the rural suburbs, the rural areas
educating
as well. Yes, educating the women. Now let's go to the issue of palliatives. I understand you're about to do some as well with other agencies, other non-governmental agencies that have been assisting government also in distributing some palliatives. You are doing some as well.
like from tomorrow, we'll be distributing our own. We want to specifically empower about 300 women. And of course, if you empower a woman, you empower the whole family. So we'll say it's a whole family. But I want to say that that's not enough. So we cannot compare what an individual can do with what the government can do. For instance, if the government, wants to actually do what they say they want to give people, you understand, things, you understand, and then people are still calling in. I can't sleep. People keep calling. I want this. Mommy, we're dying of hunger. Mommy, we're this, we're that. A lot of people are calling in, so you begin to ask.
We had the president of the youth reform group on Friday, and he raised some issues as to people are also taking advantage of the distribution. You take here, then you move on again to somewhere else, and you take some as well. Maybe perhaps we'll also bring you back to share your experiences once this happens. And then apart from that, you were also talking about the issue of empowerment in terms of some of the skills acquisition that you have done and what women are expected to do at this time, especially in terms of the sensitization that you have mentioned in the past.
Yeah, like some of our women, they are doing sanitizers and they are distributing it in their areas, where they are living. I think that also is helping our women that side, because they are not really in the town. They are outside, and I think that it was a good one actually when they called me that they were doing that. And like I was also saying, if you want to give palliative to people, there must be a way of giving it so that it will get to the grassroots, to the people. You understand? Because you cannot keep saying, people are saying, some people are given 1 bag of rice, some 3 cups of, and all those things. It doesn't make sense. So there are key people that you can use to make sure that this thing gets to the people. And those people will be able to give an account of those things that they are doing. Without that, because it's easy to give your own money. For me, I can say, John Meribe, I want to go out and give my money the way I like. Give my food stuff the way I like to anybody. But when it comes to government money, there must be accountability. So it has to be a transparent thing so that everyone will get it. And of course, you don't expect people who are hungry to stay at home.
All right.
Who does that?
Let's take one more before we go. Let's take this one. In our next report, Najatu Tijani says the Nigerian military, through the Defense Industries Corporation of Nigeria, has produced personal protective equipment, PPEs, and ventilators to fight against COVID-19. Let's hear from her.
Pressure ventilation.
Not an assault rifle, nor an automatic submachine gun. This small but mighty device has the potential to save millions of lives. It is a portable mechanical ventilator made right here in Nigeria with locally sourced materials. Likewise, these hand sanitizers and personal protective equipment, PPE.
Each unit of these kits consists of standardized gowns, face shield, and nose masks. They are currently being produced in large quantities.
First and foremost, our priority is to satisfy the national demand.
Global shortages of ventilators and other protective gear deployed against COVID-19, coupled with their high cost of production, has made this low-cost innovation by the Defense Industries Corporation of Nigeria, DICON, a strategic intervention in support of the federal government fight against the pandemic. It's early days yet for the ventilator invented by the military, as experts say projects or prototypes like this should be tested for at least 5 years before being mass-produced. But DICON says the emergency caused by the coronavirus pandemic has made it necessary to expedite this intervention. Meanwhile, in the war front against terrorism and insurgency, the Nigerian military says it has destroyed several key Boko Haram fighters and ISWAP leaders in airstrikes in Durbada, Borno State. Najatu Tijani, NTA News.
Case of defense against COVID-19, defense against insurgents in that report. The federal government has constituted an inter-ministerial committee with the mandate of ensuring food production and supply during this lockdown period.
The Interministerial Committee was constituted with a view to looking at issues affecting food security and agricultural activities during the lockdown, not only in Abuja, Lagos and Ogun State, but the entire country. The committee consists of Minister of Agriculture Mahmoud Sabananono, that of Defense Bashir Magashi, that of Interior Rauf Aregbesola, and that of Police Affairs Maigari Dingyadi, and Commandant of the Nigeria Civil Defense. Mahmoud Sabananono, Minister of Agriculture, read a communique after a closed-door meeting.
After thorough deliberations, the meeting resolved as follows. Agreed that security agencies, officials at state and the federal level should work within the framework of the federal COVID-19 emergency action response plan with relevant laws enforcement agencies to develop modalities of ensuring easy movement of foodstuff and livestock. 2. Agreed that the relevant security agencies to work in a coordinated way with clear instruction and directives to law enforcement agents at the various checkpoints to facilitate the passage of vehicles conveying foodstuff, perishable farm products and livestock without compromising national security or health measures. Agreed that law enforcement agents to liaise with local governments and state with officials in determining modalities for facilitating the movement of foodstuff and from markets during the 4. Agreed that the Federal Ministry of Agriculture and Rural Development and law enforcement agents under the guidance of the 4 ministers set up joint technical task team to draw guidelines for ensuring the safe operation of farmers' grains market, livestock and poultry market, dealers and sellers of agricultural input during the COVID-19 crisis.
The meeting agreed that drug abuse and movement of ammunition will not be tolerated.
Agreed that this opportunity should not be used to transport contraband items including illicit drugs, arms and ammunition. Agreed that the 4 ministers to convene a periodic review meeting to assess the situation and advise the chairman of Presidential Task Force on COVID-19. Agreed that the resolution of this meeting will in turn be communicated to the chairman, Presidential Task Force on COVID-19, chairman of Governors Forum and the chairman of ALGON for information and further action.
In Abuja, Musa Baba Aliyu, NTA News.
We have one more report, but we may not be able to take that because some guys are actually smiling in this situation because they are following the order of the presidency that correctional services be decongested across the country. 25 inmates were released from the Kwale Correctional Center, but we won't take that report because time is well fast spent. Let me quickly thank Reverend Ijoma Emeribe, the President of Women Africa, for coming, and we'll bring you back perhaps to also share your experiences after you have done the distribution as well as the sensitization. You still plan for the week ahead. That has been political update. God willing, we'll do it again on Friday. Remember to continue to observe all the protocols and also all the instructions that government has given as well as the NCDC during this period so that we don't continue to spread this virus. My name is Fisai Ogunfi, thanking you for staying tuned and urging you to stay on the network service of the Nigerian Television Authority, where we give you the very best of news, reviews, previews, and interviews. Bye-bye now.